How has the pandemic affected me and my role at the hospital? I would say in every way. It's really been, we've had to be creative clinically to come up with operational decisions. Also for staffing, for sure, has been a big one, making sure we have adequate staff to care for our patients, and also just the patient volume. We've seen initially a dip in our patient volume and then a big surge in patients. So the pandemic has definitely affected us in every way here at the hospital.
For me, the worst part of the pandemic would definitely have to be how it affects our patients. You know, COVID affects some more than others, and patients get sicker than others. And we've seen that in younger populations and healthier populations, not just those with comorbidities. So definitely the worst part of the pandemic is how it's affected people and their outcome of life and health effects after. But also I would say the next worst part would have to be explaining to family members that they can't be there for their loved ones in the way that they want due to isolation precautions and protecting them and us and the patient. It can be very hard and heartbreaking to have to tell that family member over the phone updates every day and listen to them wish that they could be there for their loved one, and you wish that for them as well, but it's just not possible until they're off isolation precautions, just to protect everyone the best we can. So it's heartbreaking having families and their patients have to be isolated away from each other.
In my opinion, the worst part of the pandemic has definitely been all of the illness and death that we as healthcare providers have experienced. This has been really unprecedented times where we have experienced patients that are really sick in all age categories that were previously healthy. So you might have a patient that is elderly with COVID, you could have a young patient or even a baby. So the hardest part is just how COVID really hasn't discriminated. It's affected many families and patients in a negative, grave way. In one word, the pandemic has made me feel busy. There's always something to do, whether it's creating a new workflow or working on staffing challenges or coming up with new ways we need to keep our patients safe, but there's always something that needs to be done to care for our patients, so definitely be busy.
How has my mental health, mood, and spirit for my work been affected during the pandemic? I would say it's all of our mental health and spirit and mood has definitely taken a toll during the pandemic as healthcare workers. It can just be very discouraging. You know, we see sick patients and sometimes they don't have the best outcomes, and it can be discouraging knowing we did everything we could and it still wasn't the outcome that we wanted for the patient. But our patient success stories, when we hear about a patient that left the ICU and went to the floor and then finally got to walk out of the hospital, those stories just become so much more rewarding, and we celebrate those so much harder, and it just gives us that boost of spirit that we need to keep us going and remind us of why we're doing what we're doing and why we chose healthcare and nursing, and give us that extra good spirits to move forward and keep doing what we can for each patient.
The hardest part of my job during COVID has definitely been the short staffing. We are used to being busy in the emergency department. We're used to having a lot of work on our plate, and we're fine with that. That's kind of how it goes in the ER. But the staffing has been a huge challenge, just with team members leaving to take other positions or team members just getting burned out just from the nature of COVID. So staffing has definitely been just the biggest struggle, I think, for me, and just for the hospital too.